I'm Dr. Barry Eppley, plastic surgeon of Indianapolis, and I would like to spend a few minutes talking to you about the very popular procedure called LipoDissolve. This is a procedure in the past several years that has caught a lot of attention on the press and the internet, and there is a lot of inaccurate and misleading information about it. I have performed LipoDissolve in my plastic surgery practice over the past 2 years, and I have gained a large amount of information and experience with it, and from that I would like to relay some thoughts to you as I would to any one of my patients. First and foremost, LipoDissolve, as you may know, is a non-surgical approach to removing fat by a series of injections. Placed into the body is a chemical through these injections that helps over time to dissolve fat. The most important concept that you as any potential patient needs to know about LipoDissolve is that the chemical that is being injected is not FDA approved. This is not owned or administered by a pharmaceutical company. LipoDissolve is made by what is known as compounding pharmacies, and that is ordered and sold to individual physicians across the United States. So it is not an FDA-approved therapy, for example, like Botox would be. In speaking of its approval status, it is often referred to as off-label. That is also an inaccurate statement to make about LipoDissolve. Off-label is when a drug is approved for one thing by the FDA, but then is used for another use. Since LipoDissolve is not approved by the FDA for any medical indication at all, to call it off-label is also a very inaccurate statement. So the regulatory status is on an individual basis between physicians and compounding pharmacies, and you, the patient, need to have a good discussion with your physician about whether this is an appropriate therapy for you given its non-regulated status. That is an individual decision between the patient and the physician provider. Secondly, anytime you talk about LipoDissolve, you have to compare it to the more traditional or the gold standard method of fat removal known as liposuction. Since they are both methods of fat removal, one surgical, one non-surgical, it is extremely logical to compare and contrast the two. LipoDissolve simply is not as efficient as liposuction. You can get on the operative table, go to sleep, and have fat removed relatively quickly. And once that fat is removed, other than some swelling and bruising, that procedure is over. LipoDissolve is a series of treatments over time. So by comparison to liposuction surgery, it is not efficient. The question becomes then, how effective is it? I have discovered that patients aren't that concerned about efficiency if it's going to be at least effective. In general, LipoDissolve is not going to be as effective as liposuction. The rule of thumb that I use is, if the fat area that is of concern to a patient is about the size of my hand, or you could argue anyone's hand, and it is a single or even two areas about the size of a hand, those can probably be effectively treated by LipoDissolve. It may take 3 to 4 months to get the result, but you'll probably get a result on average that's somewhat approximate to liposuction, maybe 60, 70 to 80% of the result. Therefore, LipoDissolve can be very good for some areas such as the neck, which is about the size of a hand, provided that the skin is of good quality. Small abdominal areas, small areas around the waistline or the back, the inside of the knees, or very, very small areas on the inside or outside of the thighs. So it can be effective for small areas like that. If you have multiple areas, let's say 3 or 4, 5, 6 of those areas together, then you can start to see that the inefficiency of LipoDissolve gets far outstripped by the efficiency of actual liposuction surgery. So again, LipoDissolve is not as effective as liposuction, but it can be a reasonable alternative if the areas are small and the patient is relatively thin. On average, when I look at patients in my practice, 80% of the people that come in that want LipoDissolve are not candidates for LipoDissolve. For them, liposuction is going to produce a vastly superior result in a more efficient manner. It may cost more money, but if you can get a better result, then that money may very well be well spent. And lastly, when you talk about LipoDissolve, as you look at its inefficiency and less effectiveness compared to liposuction, you get into the concept of value. LipoDissolve is certainly less expensive to most patients than liposuction, but if it cannot be effective, then it really doesn't matter how little it costs to actually do it compared to surgery. LipoDissolve can also be effective for other areas. I do find it to be particularly good for after liposuction surgery or even facelifts where there may be some small areas of high spots or fat that one wants to take down that you certainly wouldn't want to go back to surgery to do. And I have also found LipoDissolve to be very effective for the fatty tumor known as lipoma. Whether these are small or large, and many people will have numerous ones of them, it does take time, but that can be as effective as surgery, and one can avoid a scar in the same process. So again, you must think about LipoDissolve when you consider it as to how it is going to compare to liposuction in terms of effectiveness, efficiency, as well as overall value to you as a patient. Lastly, about LipoDissolve, you have to understand that even though it's very popular and is touted as a no recovery fat removal system, and that is true, no one ever said that it causes no reaction. A significant part of LipoDissolve is after an injection session, there is going to be swelling. There is going to be considerable swelling. I tell my patients that the areas are going to double in size, and that'll stay that way for about a week, and there will definitely be some associated soreness with it. That goes down after a week, and then you start to see some of the effects 3 to 4 weeks later as the released fat is absorbed and taken away from the treated site. So LipoDissolve, while it causes no recovery, it certainly causes a reaction, and you need to factor that into your consideration of how does this compare to liposuction. Well, I hope this information has been helpful to you. I'm Dr. Eppley of Indianapolis, and I wish you the best in your efforts at fat reduction.